Where does India, though, stand within the global context? That's the question we want to raise tonight. Because remember, so far at least, India seems to be doing relatively better than several other countries in the world. I'm joined today by a very special guest. Dr. David Nabarro is the World Health Organization's Special Envoy for COVID-19. He joins me from Geneva, from the WHO headquarters. Appreciate your joining us, sir. As we speak, 40 countries around the world, Mr. Nabarro, are in partial or full lockdown. Some 2.2 billion people forced to stay at home. Do you believe this is the only way of containing the spread of coronavirus? And in countries like India, are we on the right track, or could it get worse in India?
First of all, this pandemic is expanding very rapidly. It seems to double in size every few days, and so dramatic action by all nations is needed to reduce its intensity. The most important step, everybody, is to make sure that you interrupt transmission of the virus from person to person. And the only way to interrupt transmission is to make sure that people who've got the disease are kept away from others and are prevented from passing it on to them.
Yes.
Now, the best way to do that is to have communities organized to find people who have symptoms of the disease and to make sure they stay away from other people for at least 14 days. You have to keep 2 meters apart. Now, one approach to reduce the intensity of people being in contact with each other is to have some kind of lockdown. But a lockdown alone must be complemented by the transmission interruption, which means community level work to enable people to keep separate from each other, especially if somebody has the disease. And I would like to ask everybody, when the lockdown is happening, to make sure that you're doing everything possible to get community level public health work in place. It's something that India has done very well over the years, and that must be get up to full quality of operation so that people with the disease can be kept isolated. Then we can break transmission. Then when transmission is broken, the size of the outbreaks can be reduced. And when that happens, the lockdowns can be released. If you release the lockdown before you are ready to contain the disease through interrupting transmission, then you get a rebound.
You know, Dr. Nabarro, India announced the lockdown starting March 25th. Do you think, therefore, the Narendra Modi government got it right? Are we a bit late? Many countries, remember, had already imposed a lockdown by the time we did. What is the ideal moment that you believe countries have to impose a lockdown?
I want to stress that as far as we understand, the transmission in India is at a much earlier stage than it is in Europe and the US. I think it's great that decisive action has been taken in line with the recommendations of the World Health Organization by the government and people of India. But I do want to stress you have to have, as well as the lockdown, very good quality community level public health services. You have to also protect your health workers as much as possible. The lockdown alone will be important, but you need the other pieces of the comprehensive response as well.
You know, let me understand, Dr. Nabarro, one of the perplexing puzzles of this entire battle against coronavirus. Italy, one of the most affected countries, has been in full lockdown since 9th March, yet the country's death count continues to rise. United States and New York in...
I think that is the right term. Necessary, but more is needed as well, such as having very good quality public health services in the community, ready to identify people with the disease and isolate them. And secondly, making sure that health workers are protected so that hospital services are able to function. It does take some time to bend these curves. We've got very good evidence from China, as well as from South Korea and other countries that have been very, very strong in their response, that it takes a number of weeks to get what we call the outbreak curve to flatten and to get life back to normal. It will take some time, but in the process, the people of India working at community level can get control of this disease by identifying those who are ill and making sure that they are kept isolated from others. That's the only way you break transmission.
You've been mentioning the speed of pandemic in some of your writings. It's thought to double in size in around 2.5 days. It increases 8-fold in a week, 250-fold in 3 weeks, 1,000-fold in 4 weeks. We've got now over 600 cases, 16 deaths in India. At which stage do you believe we are in the cycle in India at the moment?
I think that there will be increases in India as in other countries. But the fact that the government took very rapid action, given the stage of the outbreak in India, and the fact that you have all of society working to try to make sure you've got this community preparedness, makes me feel more optimistic than if India had waited a further week or two. It's this speed of increase that's the worrying feature of this particular outbreak, and the need for very decisive and firm action right at the beginning. And I believe that what India has done is in line with what the World Health Organization wants, provided we recognize that it's several elements. It's restricting the degree to which people have opportunities to be close to each other, and at the same time having a strong community-based public health service to back it up, together with hospitals ready to receive cases and staff as protected as possible so they don't get the disease.
Dr. Nabarro, I want to point your attention towards a study that the Massachusetts Institute of Technology, MIT, has done. It suggests that 94% of coronavirus cases have happened in regions with temperatures lower than 18 degrees. And it's only in temperatures higher than 18 that the virus, it appears that in temperatures higher than 18 degrees, the virus gets less potent. Do you agree with that thesis? Because summer, remember, sets in a few days in India.
So I am really hopeful that there are reasons why the impact of this virus in India will be less than it has been in Europe and is becoming in the United States. One particular reason is that the higher ambient temperature could reduce transmission. Remember, the way you get this disease is by receiving and inhaling droplets that are exhaled by somebody else who has the disease, because it's carried in droplets. Droplets only travel about 1 meter to 1.5 meters when you cough or when you sneeze, which is why we talk about 2 meters distance. And there is a real possibility that in the hot weather, these virus particles will be less likely to survive as they're transmitted in coughs and sneezes. So I am hopeful, but we cannot use hope to determine the strategy. We do need to be strong and robust right now throughout India in order to try to reduce the likelihood that there is a real exacerbation of the disease in your country.
But you are in a sense offering hope by suggesting that in higher temperatures, particularly in South Asia, there could be a positive impact of those temperatures on reducing the spread of coronavirus. Let me ask you this, because in the World Health Organization meeting recently, it was said that India's swiftness and how India deals with coronavirus will decide the world's future. In that sense, India becomes a critical player. What is the World Health Organization trying to suggest by suggesting that India is now critical in this fight against coronavirus?
India is absolutely critical given the size of your population and also the fact that you have a really well-developed public health service right throughout the country with community-level workers who are well able to work with people in order to try to reduce disease. I believe it is in the capacity of the people of India to bring this rapid rise quickly to a reduction and then to a halt, so that the outbreaks are contained and then suppressed in your country. But it will require efforts by every single citizen. What we've learned is that if there are disputes between different administrations, or if there are uncertainties about what to do, then the virus finds its way in and causes all sorts of trouble. So this very clear direction and a very good uptake of the guidance all over the country is really excellent, but please keep it up. Don't let up. Maintain the control strategies you have in place until you are 100% confident that you're able to protect the citizens against this virus. Because even if you get the current outbreak and pandemic down, this virus will still be with us, and we need to be on guard and defending ourselves with high alert for the foreseeable future.
You know, you're giving us again very important information. You're saying don't let up, because you're suggesting that the virus could return. Am I correct? That you're saying the virus won't go away that easily. It may slow down, taper down, because there have been World Health Organization reports recently that say the virus could survive in the air for a longer period. It could be transmitted through the air and not just in other forms. Is there a fear, therefore, of the disease getting airborne, Dr. Nabarro?
So there are some pieces of evidence that suggest that the virus doesn't always stay in droplets. It can actually get into the air. But it's absolutely clear that the main means of transmission of this virus is in droplets. Please hold on to that. Now, you just were saying, I think as well, that there are worries perhaps that after you've dealt with an initial outbreak, that it might come back again. And that's absolutely true. In China, where they've been remarkably successful, there are fears that reintroduction by travelers that come into China from places where there's a lot of infection will lead to new clusters developing. And the Chinese authorities are absolutely ready in order to be able to identify quickly if there are new chains of transmission and to contain and suppress them very, very robustly and rapidly. And that will be necessary in all countries until we have a clearer understanding of where this virus is going to take the world in the future. At some point, there may be a vaccine. And if there is, it will be possible for everybody to be protected by being immunized. But we are some way away from that, which is why best quality community-based public health, supported by strong action by governments and protection of health workers with maintenance of hospitals, is absolutely key to this response, and doing it robustly now is key.
Many are also concerned, Dr. Nabarro, about the slow rate of testing in parts of India. There are critics who are saying we are not testing enough. What are your thoughts on that? Do you think that when this is the best strategy for a country like India to test and test more?
The World Health Organization is clear. Testing for virus is an important part of the response strategy. It's hard to be able to get communities to interrupt transmission if they have no clear idea of how much virus there is in their area. So the testing is really useful. And some countries like South Korea have used widespread testing as a mainstay of their response. But we have to be realistic. There are an awful lot of other countries that are doing very little testing, including some countries in Europe. What can you do then? Answer: you have a high index of suspicion that everybody with a high fever, a dry cough, and chest pain and shortness of breath, and it's a pretty standard pattern, should be assumed to have COVID unless otherwise shown, and should be isolated immediately their symptoms appear. And if it's possible to isolate them from other members of their household, that should happen. Otherwise, as is happening in many countries, the whole household should be isolated for the 14 days in each case until we are sure that the disease is finished and others have had a chance to show whether they're infected.
You know, Dr. Nabarro, there's also a sense in this country, the positive news, the health ministry reiterated it today, that we have not allowed the virus to go into stage 3, not into community spread. Do you believe that India now is in that, therefore the next 2 weeks are that key opportunity to prevent the virus from entering stage 3, or do you think it's inevitable that there will be some community spread?
And this is the key point. We're asking citizens everywhere to change the way in which they behave. We're asking public health services everywhere to be on high alert. We're asking hospitals to get ready, even when there may not be much virus moving in the community. And that's the right thing to do, because the sooner you can get on top of these outbreaks and contain them and then suppress the transmission of the virus, the less likely you are to end up with an explosive situation like we have in parts of Europe, very close to where I am in Geneva, Switzerland right now. Act early, act robustly, act without regrets, and that can greatly reduce the magnitude of the problem that you will face later. I know it's a sacrifice, I know it's a struggle, but it's so important to do the actions now rather than to not be so comprehensive and then some days or even weeks later then scratching your head and say, why on earth didn't we do it quickly? This is the challenge faced in much of Europe right now. Leaders are saying, well, perhaps we should have acted earlier. But now I think India can learn from the Europe example, can also learn from China and South Korea, and really show the world how you can keep a huge population safe in the face of this threat.
A final question, Dr. Nabarro, and I know it's a tough question to answer, but many people are asking them. Is there any kind of assessment being made by WHO as to when the pandemic will end? When will we get into a post-coronavirus world?
Well, I'm really saying to everybody that I believe the world will have to learn to live with corona in our midst. And that means being on a constant defense everywhere. But if you're on constant defense and can deal with outbreaks as they emerge quickly, as we do with other infectious diseases, then you can avoid these giant outbreaks from occurring with all the damage that they cause. And that's what the end will be, that it will be the whole world on alert and ready to pounce as soon as new cases emerge in order to keep economies going and societies going. I don't believe at this stage that we can talk in terms of completely ending the whole thing. I think we have to be learning to live with the corona. It's going to be the new reality for everybody. That doesn't mean that everything has to stop. It just means we have to learn to run our lives with the corona threat in our midst, and we have to learn to respect what this virus can do and to deal with it promptly. And this is all until we've got a vaccine. When there's a vaccine, probably 18 months, we'll be able to reassess.
Dr. Nabarro, it's a pleasure talking to you. I will remember those words, and I think all our viewers should respect the virus, learn to live in a world of corona. Thank you very much, Dr. Nabarro, for joining me there from Geneva and giving us your thoughts from there. The World Health Organization Special Envoy.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.